I need to acknowledge the chairman, the president, and all the members of the high table, as well as people sitting on ground on the opposite direction. Please permit me to sit to continue. Well, malaria is one of the oldest diseases documented, several centuries, the millennium, I would say. Not until 1880, when one French, Charles Laveran, Alphonse Laveran, saw a parasite in the blood of a 24-year-old soldier. He saw it but didn't understand it. 17 years later, in 1897, another man came up. That's Sir Ronald Ross. And there I was able to learn that it's possible that mosquito bite was responsible for malaria, but I didn't know beyond that. Then another scientist, a physician, Patrick Manson, eventually linked the two. That is the bite of mosquito leading to the disease. By the year 1900, it was published in British Medical Journal that what was actually responsible for malaria was the bite of a female Anopheles mosquito. And at that point, the knowledge was clear, and every country went to action. By 1912, Belgium pushed malaria to a point where it was no longer a public health disease. By 1922, Britain was able to push it down to a point that it was no longer a public health issue. America lasted to 1947. By 1964, almost all the European countries have been able to eliminate malaria. And coming down to Africa, unfortunately, no African country achieved this. Nigeria hosted the biggest meeting on malaria in the year 2000, which led to the rollback malaria meeting in Abuja here, and where there was Abuja Declaration. 25 years gone, Nigeria is still having malaria. We were lucky in the past few years, about 4 African countries have been able to achieve elimination. Algeria has been able to eliminate malaria, and Cabo Verde of recent, we had also has eliminated malaria. Nigeria hosted the rollback malaria, and just last year, the coordinating minister hosted another big meeting that brought almost the entire world in the medical field to Abuja, and that was rethinking malaria in Nigeria. All these are the efforts. Where are we as a country? We indeed probably have not done enough. And one of the 9-point agenda the coordinating minister mentioned was the community involvement. And it rings very clear in this particular meeting, involving children. We should also know that malaria is not just a health issue. We look at it from the point of our failure, that is the sickness. But it's infrastructural problem, it's environmental problem, and the consequences could be emotional, could be economic, and several others. These are the things we've been battling. And I must commend you that the efforts of your organization, Geneith Pharmaceutical, is great and is laudable. And I think it is driving one of the points of the coordinating minister home. On this, thanking the chairman for inviting the coordinating minister, who unfortunately is unable to be here this morning because he traveled out. And he has asked me to represent him and also to congratulate you and bring his facilitation to this program. On this, I want to declare and launch the Geneith Geneith health competition open. Thank you very much.